One interesting discovery that I've had about group medical appointments is that the people who have the hardest time getting their heads around it is us, medical professionals. Patients often do a great job of understanding why it is they need it, how they can benefit from it, and especially after they've seen their first group, they totally know how to use this. The skepticism and the discomfort come from medical professionals, because that's not how we're used to seeing patients. Thinking back, I was talking to a physician, and she told me, she said, Deanne, she says, I don't have any depressed patients in my group. And I said, really? Because, in the groups that I've been in, I've seen a lot of depressed patients. She goes, no, I don't have any. So I went and saw her group, and I saw 3 people there that were not only very depressed, but 2 actually I needed to do a suicide interview with, just to make sure that we didn't need to commit them right away. They were so depressed. And as I was doing these interviews with them, what was happening is the physician was sinking lower and lower and lower in her chair. And if there would have been a hole in the floor that she could have crawled through, she would have crawled right through that floor, because she wasn't comfortable talking about depression, particularly in front of a group, because she had her own stereotypes and her own beliefs about depression. And what we have to look at is we have to look at our own levels of discomfort. What are we uncomfortable about? Because what I've learned in group medical appointments is patients will talk about whatever it is that the providers are willing to hear.